You have tried getting pregnant 1 month, 2 months, 3 months, and now you're now worried what the problem is. Are you suffering from infertility? Those are the kind of questions you keep asking yourself. Today's video, we're going to be telling you what infertility is all about, or when do they talk about infertility, where we can start saying there is a problem somewhere that needs treatment. So this is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. And if these are the kind of content you like to watch, don't forget to subscribe to this channel so that you won't miss out on any video. So let's dive right in. There are various causes of infertility. But now, when do we talk about infertility? In a woman who is less than 30 years old, according to the World Health Organization, infertility is defined as the inability to conceive after regular intercourse for a period of 1 year. And when you talk about regular intercourse, what do they mean? That's 2 to 3 times per week without any protection or without any use of a contraceptive method. 2 to 3 times per week, and you have not gotten pregnant. That is when you talk about infertility at the age less than 30 to 35 years of age. Now, above 35 years of age, if you've tried getting pregnant, regular intercourse, like I said, 2 to 3 times per week, I'm not talking about maybe the person is out of the town and comes once in a while. We mean regular intercourse. Here, we talk of infertility after 35 years of age when you have had regular intercourse for a period of 6 months and no pregnancy. Why did you talk about 6 months? Because at 30 years, the rate at which you get pregnant decreases, and at 35 years, it really declines, and at 45, it's even really slim. So the number of X2 has reduced, the ovarian function has reduced, so it is not more as before. So if you are trying now for a period of 6 months, then it should be a call for a concern that there is a problem somewhere. So that's when we talk about infertility. And now there are various causes of infertility. We're going to talk about the various causes of infertility in another video. So if you like this content, you can click and subscribe so that you'll be the first to receive such videos. So that is when you talk about infertility. So if you've not had these regular contacts for that period of time, then we cannot yet talk about infertility. And when we talk about infertility, it means that there is a pathological cause that needs to be addressed. But if you see, for example, when they talk about 2 to 3 times per week, they are assuming that even within that time, if you didn't know your cycle correctly, if you're having 2 to 3 times per week, at least you should have had intercourse during your fertile period. That's why when you always go, sometimes 1, 2 months, 3 months, and 4 months, they're not getting pregnant, and you might go to the hospital that time, and they might just advise you on your cycle, on how to know your fertile period and that, and we want to see you get pregnant during that period. Now, there's one thing that actually reduces the ovarian function of women that causes a huge decrease in ovarian function, maybe even before the age affects, is smoking. Smoking, that nicotine in smoking destroys your eggs. So please, any woman out there, if you're smoking and you have plans of getting pregnant, please quit smoking, please. Now, there are other things like rays, X-rays. If you're exposed to X-rays, maybe you want to do X-ray after an accident or to check for other problems. Those rays goes and affects your ovaries. But now they always weigh the risks before doing any X-ray for you. If it's important, then you have to go for it. But those kind of things to affect the ovaries. If you have pathologies that also affect the ovaries, if you have like cysts, fibroids that tend to occur in the ovaries. If you have had surgeries to the ovaries, you can have some ovarian cysts where they went into doing surgery and remove part of the ovaries. They have also removed part of the egg, so it can lead to a decrease in the ovarian reserve. If this was helpful, give a thumbs up to our video, and don't forget to share the video out there to all other women out there so that this can help a sister and a friend. Thank you very much, and God bless you.